Meanwhile, many questions are being asked about the physical and psychological impact rape has on minors and other survivors. To discuss this further, we're joined by Dr Mahendra Pramchand, the General Medical and Aesthetic Practitioner at Herrwood Medical Centre in Durban. A very good morning to you, Doctor. Thank you so much for making the time.
Good morning, Desiree.
What are the physical and psychological impacts of rape on children and rape survivors?
It's devastating. If you look at the physical aspect, we're looking at trauma to genital areas, vaginal areas, anal areas. It can even impact on the child's fertility. Psychologically, it's also very devastating. They start distrusting people of the opposite sex or people of the same sex, and these trust issues continue into later adult life. And what happens is the post-traumatic stress disorder, the depression that occurs after that, is really adversely affecting and would adversely affect the victim.
The children that were raped in Pretoria by an older man, what kind of counselling would they need?
They would need counselling by a person who is experienced with respect to that type of counselling. We're looking at counsellors, social workers. The setting is very important. It has to be done in a scenario that's not too clinical, with the guardian at the side of the patient, and use of drawings, pictures, use of mild suggestions and waiting for answers without pressurizing the victim. These are some of the techniques used that will be able to ensure that the information is correctly retrieved and appropriate action taken.
Just give us a sense, as medical practitioners, how often do you have to deal with consultations involving rape incidents?
It's getting very common. 41%, the latest statistics show that 41% of all victims are children. And it's independent of gender, male or female children.
Which is quite unfortunate, really. But what more can be done to ensure that rape survivors don't feel more violated after rape? How should their cases be handled, for example, when coming for medical examination?
Firstly, it should be done in a not too clinical a setting, as I'd said. The use of a female nurse, female practitioner who gently ask questions and documents the answers is very helpful. If a guardian who that particular victim trusts is with the victim, it's also a great help. Victims should not be pressurized to answer direct questions. Rather, suggestions through drawings and toys may give a more appropriate response that can be used, and a more honest response.
What kind of advice would you give to rape survivors? Does it make a difference if a rape survivor has showered after the incidents? Does it destroy the much needed evidence or not? Just in terms of the things to do to ensure that when you go to the officials, you have a watertight case.
The idea is not to shower after the incident because DNA analysis, sperm analysis is vital. And much of this can be destroyed when bathing, using soaps, etc., rinsing, running water. So that's best. But still, if they have accidentally done so, they are still to go to the authorities and indicate, listen, this is what has happened. Because some areas, intravaginally, intraanally, may still have semen, and specimen can be collected appropriately.
Yeah. As we get into the festive season, what is your message to families and parents? We live in a society riddled with gender-based violence and where children are soft targets. What should be done at this time?
Children should be monitored very carefully, especially in busy places like malls, the beaches. Have an idea of who your child is with. And your children should be taught to report any suspicious behavior, any untoward advances towards them, anything odd. To have an open, trusting relationship with your child is vital in this type of scenario. And as I'd say again, keep an eye on your child in busy areas. Simple things like holding the child's hand in a mall and observing for untoward behavior yourself from people that you know is also important.
Let's thank you for talking to us this morning.
Pleasure. Thank you.
Was Dr Mahendra Pramchand of the Herrwood Medical Centre in Durban reflecting on the psychological and physical effects of rape.